Good afternoon, good morning, and welcome to everyone to today's webinar with Dr. Simon Peng-Keller and Pascal Mösli, titled Chaplain Documentation, a Review of Charting Spiritual Care, the Emerging Role of Chaplaincy Records in Global Health. I'm Andrew Andresco, Project Coordinator for Transforming Chaplaincy, and we are delighted you could all join us. The response to this webinar has been amazing. As of this morning, we have well over 900 registrants. I just want to take a moment at the top here to thank our good friends and co-sponsors for this event, the Chaplaincy Innovation Lab. You can learn more about the network at their website, chaplaincyinnovation.org. Just some housekeeping instructions. If you have any technical questions, you can refer to the dashboard and you'll see a chat box, and I'll get those. We're taking questions for a Q&A. There's a question tab in that same dashboard. So you can type in questions throughout the broadcast. We'll be collecting those and we'll have a session at the end. Lastly, you're listening using your computer speakers and by default are muted. And with that, I'd like to turn it over to Dr. George Fichet, the Executive Director of Transforming Chaplaincy.
Thanks, Andy. Welcome, friends. We're glad to have you with us for today's webinar. It's my pleasure to introduce the two coordinators for the webinar, Jeanne Wirpsa, who's a board-certified professional healthcare chaplain, clinical ethicist, educator, and researcher with over 25 years in the field. Jeanne is program manager and clinical ethicist for the medical ethics program and research chaplain in the Department of Spiritual Care and Education at Northwestern Memorial Hospital here in Chicago. Some of you will know that Jeanne is the co-editor with Karen Pugliese of the 2020 book of case studies, Chaplains as Partners in Medical Decision Making. Jeanne has had a strong interest in chaplaincy documentation for a while and is co-author of a 2016 study of chaplain charting practices. The title of that article was Communicating Chaplain's Care, Narrative Documentation in a Neuroscience Spine Intensive Care Unit. Jeanne is a co-convener of Transforming Chaplaincy's Chaplaincy Functions Research Network. Joining Jeanne in today's webinar is Christina Shu. Christina is a board-certified chaplain, and she is the lead interfaith chaplain at Cedars-Sinai Medical Center in Los Angeles. And with Jeanne, Christina is the co-convener of the Transforming Chaplaincy Functions Research Network. Just want to mention in terms of procedures that we are recording the session, and the recording will be posted probably within about 24 hours. So for those of you who want to share it with colleagues and tell them about it or look at it again, that recording will be available. Christina, Jeanne, let me turn it over to you. Thanks so much.
Welcome, everyone. We're really glad to be here today. I think I've advanced to the next slide, though I just lost my slides again. Okay. I can't even remember what the slide says since I can't see it. Christina.
Oh, Jeanne, do you want to?
Why don't you jump in? I literally can't see it.
Apologies, everyone. We're having like a little bit of a technical problem. So, Jeanne, we're just going to give an outline of our plan for this webinar. So Jeanne and I are, again, co-conveners of the Transforming Chaplaincy Research Network for Chaplaincy Functions. And we've identified a huge interest in chaplain documentation as part of our network. And documentation is something that many chaplains find challenging, find a great source of information and a potential area for research. So we had one webinar last year about documentation and about some recent research projects in that area. And when this book came along, Charting Spiritual Care, we thought it would be a great follow-up to continue our conversation about documentation and chaplain notes. So our plan is to ask our panelists to talk a little bit about the book and how it came to be and what the process for creating it was like. And then Jeanne and I will have some dialogue with our two presenters, our two panelists, about trends that we saw in the book and questions that we have. During this whole time, please feel free to enter any questions that you have in the question box, the question section. And in the last 15 or 20 minutes, we'll take questions from the audience. And then we'll talk a little bit about some next steps. So Jeannie, you can go to the next slide. Perfect. So this book, Charting Spiritual Care, the Emerging Chaplaincy Records in Global Spiritual Care, is free online, and we've included the link right here. So if you're interested, please take a look, and you can look at every chapter. It's really wonderful that it's accessible to everyone. Next slide. So now I'll introduce our presenters. Professor Dr. Simon Peng-Keller is the professor for spiritual care at the University of Zürich, the second such professorship in Europe, and his primary research focus is healthcare chaplaincy and interprofessional spiritual care at the end of life and in the context of spiritual disease. Okay, now our slides have changed a little bit. I think I can continue. And Dr. Peng-Keller is the co-editor of this recently published volume, Charting Spiritual Care. And then we're also joined by Pascal Mösli. He is a research associate at the for spiritual care, also at University of Zürich. And Pascal also worked as a chaplain for many years, and we're really excited and contributed to one of the chapters that is in the book. So we're really thrilled to have both of them here with us. And I think we might be the first webinar that has had international guests. So it's really exciting. If we can, Jeannie, can you show slide 5?
Are we on the slides now?
Yes, we're on Simon's slide. It's the 5th slide.
I can't see any of them. I can't even see them to advance. Oh, there we go. Are you seeing them now?
Oh, we're seeing them, but not, yes. And click one more.
There we go. Ha!
Perfect. Okay. I'll turn it over to you, Simon.
Yes, thank you very much for the invitation. It is exciting for us too to be in this global context with our project, and I would like to delineate a little bit the process, how this project came up. In fact, it was a bottom-up initiative. It was the initiative of the Swiss Associations of Healthcare Chaplains. They see very early that there is a bundle of unresolved issues in the field of charting, and started with a working group, and then afterwards came this research group and project. So it's a bottom-up project and a participatory research method. 2 members of the associations are also members in our research group. So we try to be very close at our context, the Swiss context, and this, of course, it's the final aim of our project. We would like to gain perspective for the development in Switzerland and models. But for this final goal, we had as a first goal to get the international state of the art. So we convened the first workshop, an international workshop, and this book, Charting Spiritual Care, is the product of this first international workshop, which was very inspiring for us to see all this development everywhere in these countries. And yeah, we worked on a second book in German, more focused on conceptual and ethical issues. And at the moment, we are writing a white paper together with the European Research Institute of Healthcare Chaplaincy. And at the same time, in Switzerland, we are organizing workshops for kind of a feedback process with the chaplains to learn for them how they interpret this international perspective that we have collected now. And finally, Pascal will write his PhD, so he will do the final cooking of this project. And we started yet a new project, a follow-up project on the issue of digitalization of spiritual care. So a little bit a broader perspective, which includes also this aspect of charting. So that's it for the moment as a short introduction of our research project.
Thank you. So now Jeanne and I are going to kind of talk about some things that we found interesting in the book and engage with Simon and Pascal. And Jeanne, Andrew can become the slide presenter. So if you would like to switch, that might be a little bit easier for us.
Excellent.
Yeah.
There we go. I can see you guys now.
Amazing. Perfect. So I'll start off, and what I wanted to ask about is, again, since this is really the first time we've had perspectives from outside the United States, I'm curious, in looking across all of these different countries, what are some of the similarities, difficulties, maybe similar challenges faced by chaplains with regard to documentation? I know you have perspectives from Switzerland, UK, America, Australia, right? So yeah, look, what are some of the similarities and differences there?
Okay, I'd like to start with this question. I would say, on one hand, among spiritual caregivers in Europe, that's a start. There is no unity either regarding feelings or beliefs on charting. So that's one starting point. And there's also is not an exact role or self-image of pastoral care in the healthcare system. That's also very discussed. So that's on the one hand. But on the other hand, and that seems very important for me, there is a growing understanding of the high importance of documentation for interprofessional cooperation. So we say good care means shared and coordinated care. So there are some surveys in Belgium, Holland, and Switzerland. We discussed with the colleagues, and most of the colleagues they agree. So it's that there is a high importance of documentation for the interprofessional cooperation. And it seems to me that even if fundamental issues are still being discussed, we follow with us further, it's no longer a question of whether documentation should take place, but how. And one sign of this are the processes of standardization that can be observed. We have national guidelines in Australia, professional guidelines also in Switzerland, and the project of Erich Simon was talking about. So this is a research group consisting of chaplains and researchers from across all Europe with the intent to publish this white paper on chaplaincy charting in electronic patient files. So that's an overview. And if we go a little bit further, one thing what is clear, I think, in many countries, that is before developing a tool in an institutional context, the goals and target groups of the documentation must be really clarified. Is it for intra or interprofessional collaboration, justification for funding, research? So that must be clear. And what's also very important, I think, in all these countries is that we have to be aware of questions of connectivity or compatibility. So the linkage with prerequisites of the healthcare system, especially in palliative care, but also in other systems. So, for example, in Switzerland, if we don't chart correctly, we are not members of the team. And then questions of connectivity with funding. In our place also, for example, we have to show our services towards the public system and they finance us. In Canada, for example, the pastoral services is built by health insurance companies. In Australia, pastoral care is included in the ICD-10 system. So this connectivity is in many places very, very important, connectivity of the documentation. Question of format. I have got the idea that I think in the US it's quite clear, the 5-step model, reason of referral, assessment, intervention, outcome, plan of care, these 5 steps. In our countries, because the goals, the mandate and legal framework, also the restrictions are quite different. There are similar models, but also very different in documentation and formats or models. So, for example, formats which follow more the logic of the financiers, because they represent the services of chaplaincy. And what's intensively discussed is the question of the underlying basic understanding of spirituality and how the contents and the process of accompaniment should be described. But we come to this point later on. And one thing I already mentioned, this is the interprofessional goal is very, very important. And there's some questions arises also here. So one is the question, I put it like this: what exactly do we want the team to do with our information? So do we only show what we are doing, or do we want to consciously and actively influence the actions of the other health professionals? Maybe we can discuss this later. And then one last thing, what is also very discussed, I think also in your country, but also in Europe or in other countries, is the patient story is the main issue. Anne Vandenhoek puts it out of Belgium like this. She says chaplains are bearer of stories, and how we put them in the documentation. And there's a high importance of confidentiality. This is a very, very big issue in our countries. But also this does not mean we cannot share information, of course. There's a little research in Switzerland, and they asked patients if they agree if a chaplain share the summary of the visit with other care providers, and 70% of the patients, they say, yes, we agree. For us, it's a very important. And also an important question there is, do we share all our information with the members of the team, or only the one who are important for the interprofessional cooperation? So should there be 2 fields, one for the team, the other for the chaplain alone? And last, important nowadays, of course, very important, is that the patient may read the notes himself. So charting is getting a tool of communication with the patient. So till here, some points.
Thank you, Pascal. Simon, do you want to say anything or add anything to that?
For me, the main insight was that this is really a global challenge. So there are a lot of specificities and difference, but the core issue, I think it's a global challenge of healthcare chaplaincy, and that's a exciting thing. So we are together in real time on the main, working on the main topics. So this is because of, I think, globalization of healthcare in general, but also this globalization of the digitalization. So we are using the same tools, and we have the same problems with these tools. So and I think there is a great opportunity for working together and for new forms of also research networks, perhaps also exchange for practical issues. So I think we are at the start of, perhaps it's a little bit too enthusiastic, but we are also at the start of a new area of CPE and development of the profession of healthcare chaplaincy at the moment. And in fact, it's a very dry and technical question, this documentation issue, but on this point you have all questions which are relevant for healthcare chaplaincy. So all the conceptual issues, what is the spiritual dimension of healthcare, and what is the role of healthcare chaplains in healthcare systems, and etc., are linked with this technical issue of charting. And that's something very strange, that on such a dry topic you can have such exciting discussion.
I think we actually have we've maxed out our audience, so we have 500 people. So that shows that even for such a dry topic, that many people are interested. And like you said, Simon, that documentation gives a window into all of chaplain practice and how we describe what we do and why we do it, and the theory behind what we do. So I think that's part of the reason people are so interested. I wanted to kind of, oh, Jeannie, do you want to?
I was just going to jump in and say, I think the other point that you make so strongly throughout your book is that the actually core issue of who we are vis-a-vis the healthcare team, what our role is, where we locate ourselves, our dual identity, all of that actually charting and our research on charting is a window into those big questions. And that's where I noticed there was, again, some strong differences across countries, you know, all the way from the UK, where it feels like they're so not integrated into the healthcare system, to some other locations where, again, we're not church sponsored, so to speak, and we're considered full members of the healthcare team, I think, here in the US. So really appreciated the insights into that question.
Yes, you have these questions with the language. So language is the most important tool for chaplains, and which language you use, so you know it should be understandable for other healthcare professions, but it should be have this spiritual aspect. So you should change to a totally healthcare language. It would be a pity. So we are challenged on the core issues of our profession. Language and stories. Stories matters, but how do you write good stories and confidential, enough confidential stories in medical records? It's a huge challenge.
So with some of these issues, like integration into the interprofessional team, and you also mentioned that in certain countries, financial backing is quite important in how you chart for financial or insurance purposes. There are other countries in which government regulation is really important and controls some of what chaplains do, and whether they document or not document. Just wondering what you heard from chaplains themselves about how they are in conversation with some of these forces, or maybe advocating for stronger roles, or you know, how they're existing with all of these things that are kind of impacting how they document and how they practice.
Pascal, perhaps you write the Canadian model, or
pardon?
The Canadian process would be exemplary case for this, but you have.
Yes. For example, in Canada as well, like this, the chaplains, they were coming from the church. They were from the churches coming into the hospital, and then there's a big change. For example, in Quebec, so now the chaplains are members of the healthcare teams. So they have to translate. They had to translate what they do in the health system. So show in the health system what they do as chaplains. So the documentation was also a development of the language, the development of the contents and of the language. And there was one what we found very interesting is how we can tell what we are doing in the health system, but still it has got the spiritual dimension. So it is this work we found very interesting in Canada. But in all contexts, we see that the development of a charting system, it's for the chaplains. It means to be conscious of what they are doing, and what's important, that what we found in these surveys is that we want to work with the other healthcare members. I thought that's everywhere. That's clear. If you're in a hospital working as a chaplain, you want to work with others together. So you have to find a language what fits in the system, but also it shows what is the spiritual dimension. It's not the medical language; it's a spiritual language. I think that's one of the big challenges. So we also have to teach the medical system what we are doing. It's not only to fit in the medical system, but also to teach the medical system to make broader the definition of health, for example.
I can't remember which country it was that used ICD codes. They developed specific spiritual. Where was that?
Australia.
Yeah, so
In
things
Australia.
like that, which again kind of drives then how we use the EMR, right? The electronic medical record. If it's really about, again, getting a code in for reporting off to the government that you're here providing care, it just seems like that could distort or potentially direct our energy away from some other dimensions, right, that you've mentioned that are important.
Exactly.
Yeah, I think I'm particularly concerned about the digitalization, and a couple of your authors talked about the marketplace forces of the electronic medical record, and how that has the potential for disappearing the patient if we aren't careful with it. So again, these forces of technology, it wasn't designed for chaplains to be documenting in. What was the electronic medical record designed for, right? Certainly for sharing mostly of diagnostic codes of what's going on medically. So how to marshal it for our use is really challenging. I know your author spoke a lot about that, especially your ethics author, as well as some others. I wonder if you want to say a little bit more about promises about maybe being able to push back against some of how its design limits our use.
One point which is interesting historically, that these are two separate strands. So the research of documentation practice in healthcare chaplaincy isn't due to digitalization, but digitalization gives them a lot of power. And I think that's the main point, that is these tools are very powerful, and you should use it wisely. So I would say we should have tools that are flexible enough for use them in our own ways. There is a pitfall, I think, to generate too much information. So it's fascinating what tools can generate with checkbox and whatever. So I think we should use them or develop them in a careful way, so that they are flexible enough in daily healthcare chaplaincy work. So not too much checkboxes, and yeah, the language issue is certainly a main point. So the tools can offer us some items, but we should not lose our own narrative language as healthcare providers. So that's they boost development, but the development we have to make it ourselves as chaplains. So machines are only helpful and sometimes also challenging for new processes, but the main learning process is something which isn't in the digital sphere. It's not the questions of using digital tools, but it's the questions of develop your own language as healthcare chaplain.
So that's a lovely set. Go ahead, Pascal.
You know, we started, maybe you know this guy, David Byrne. He wrote an article about, the title is Writing the Wrong. He wrote an article for healthcare professions, and there he said, you just have to use checkboxes, because otherwise you have no language what is clear. If you write notes like little stories, nobody will read them and they are not clear, like this direction. So we also started in this direction because we found it's very interesting to have really a very clear language. But then after time, we saw if we do that, we really lose the patient in all this informations. So we have to get the story beside these informations. We have also to get a story, and maybe the checkboxes. They help us to learn the language to afterwards write the little stories. So we have the language which is clear with the checkboxes. We know what we write, no code language. Also a language what is clear with other professions. But then we write our little story to really describe the situation of the patient in this case, in this situation.
So how do we know that what you're describing, you've kind of shifted us to talk about best practices, models that are out there, and you're actually moving in the direction of suggesting that it's important, I guess, theologically, conceptually, to preserve the patient's story, but that we also need a normative language, so a combination of checkboxes and narrative. How do we know that that's the best practice? How do we know that that's what our colleagues want to see? What evidence, now I'm going to move in that direction, what research is there to suggest that that's what we should be doing and that it makes a difference?
I think it's too early to speak about the best practices. We have now experience from 2 decades of practice and 1 decade more or less for research in this area, and so we have I think good ideas what are good practices and what is functioning and what not. So I think we are in the midst of the process, and we have some clear perspective. I think that's yeah, I think we can see very clearly some pitfalls, this overstructuring issue, or to generate too much information, and what we are talking about checkboxes, that they are useful for certain information, but that some form of narrative synthesis should be provided too. So my mantra is short, structured, and stored. I think that's the essence of 2 decades of electronic chaplaincy documentation. So there are some studies, and you have done also one which looked after how other healthcare providers are reading or not reading the charts and what they find useful or not useful. So one thing what is very clear, that the charts should be addressee oriented. So what say other healthcare providers about our notes? And here we have some evidence from research what they think is useful. We have very few insights from patient perspective. I think this is one very important issue for the future. We should include patients in the research and in the development of charting. So we should know how they see their own charts and what they think about usefulness. And we have very little evidence what's the impact on the care relationship. and even less evidence what is the impact on quality of care and quality of life for patients. So there is a lot of research that should be done in this area before we can speak about best practices. So we are at the very beginning. There is a decade of research done now.
I found it interesting that many of the authors wanted to claim, kind of they observed, it was kind of anecdotal that we knew this was best practice, right? Or made claims like spiritual care documentation leads to better quality care, right? We've observed that this helps interprofessional communication. And I kept saying, have we now? Again, how do we know that? And I think, again, we as a profession, in terms of our expertise, are observing that, and we're believing that that's the case, but we need to develop these models in a more rigorous way so that we can test them and begin to do, as you said, some more research on what we're claiming to be our outcomes of our charting. I think Paul Gauchette's research is really a breakthrough. I'm hoping that some of the folks who attended our seminar or our webinar a year ago are on the line today, because we had hoped that some folks might actually replicate those focus groups in other areas. Again, he did it with a very small local group of palliative care clinicians, but at least it told us something, right? Which we have not had. So to see what it is that pediatricians want to hear, what it perhaps is that are the content areas that emerge in the intensive care unit or in chronic care, are those different than what emerged in palliative care? So of course in palliative care it was medical decision-making came up, you know, again as the main topic. Perhaps in other areas it would be something different, but we don't know. So we can't use his work, we can't generalize it at this point. But at least it's something, right? Mm-hmm. You guys did. Go ahead.
We have just a little research in Switzerland, a very little one, where they asked, they did documentation chaplains, and then they showed it to the patients, and they asked them, "Is that your story? Is what we have written in the documentation? Is that what you told us? What is important for us?" And there it was I think about 100% of the patients said yes. That's a little bit, it was a little survey, yeah? Really not many people, but that's the way to go, I think. That's really important. But then we have many questions coming with the first question, for example, they knew each other, and what will they tell if you have larger numbers, all of that. But I think that would be very important. I think for us in Europe also one difficulty there is also the context, because we have in our hospitals, we have really to tell the healthcare system that spiritual care is one dimension of healthcare. We have to get also this basis for having then the opportunity to make research. But I think we have to do it. There's no question about that.
So Pascal, you're speaking to that question then, I think, of how do we evaluate these competing claims about what best practices are? Is it on the basis of what we as a profession think is important in terms of representing our dimension of care? Is it promoting holistic care? Is it that patients recognize themselves? Is it that it's usable and accessible and makes a difference in interprofessional communication? It's almost like we need to name what those criteria are going to be for evaluating, right, our claims, yes. And then find out figure out how to measure them. Yeah,
exactly.
I think we should also have an open discussion what means best forms of writing stories in this form. So I have in mind a kind of a collection of case studies, as you have done for medical decision making. So with the commentaries, so a case study with the integrated with the exemplary case of charting, and then a discussion about how we we think about this art of charting, what we think about what's a good story, a clinical relevant story in such a context of illness. So I think we need a intra-professional discussion about all these issues, and especially on the issue of language and narrative.
I think we should transition to taking some of the questions from the audience. There's quite a lot. But I do just want to really affirm that I think this is very interesting for many chaplains, the idea of how we accurately represent a patient's story, and that we think of ourselves as, like you said, bearers of stories. And, you know, the idea that we might be co-writing a story with input from the interprofessional team and also from a patient. That idea of like checking with our patient, is this an accurate, you know, articulation of what you've told me? I think that's really quite exciting, and I hope that we might see that in the US too. So Andrew, if you could go to the next slide, and I think it's just a Q&A slide. And George, if you want to rejoin us to help with some of the questions. I want to say it does look like some of our participants are from other countries, and there have been some questions in other languages, which again, we've never had before. So it's pretty exciting. I'll say there have been a couple questions about the Cures Act in the US, and that is something that we are planning another webinar. So stay tuned if you're interested in the Cures Act and open notes.
Actually, we're going to do two webinars. One is kind of an introduction to the Cures Act and open notes, and we'll use some of our folks from the open notes project to present that. And then we'll do one specific to, okay, what are we chaplains going to do? How are we going to adapt our practice in light of what the research has shown from other disciplines?
Yes, so there've been a few folks who've just kind of said, you know, is this being recorded? Yes, it is. It is being recorded. We'll have the recording up probably by tomorrow. Jeanne, Christina, we haven't asked whether or not you'd be willing to share the slides, but I think we probably could say yes to that. People have been asking about where's the link to download the book, and we've put that in the chat. But if you actually just Google Simon Peng-Keller, it'll take you to the book, and it'll take you to the publisher's website, and you can download it there, or Google the title of the book. It's pretty easy to find it. Some people have been asking about references to things that have been mentioned. So for example, Paul Galschutz's study about what do palliative care physicians and nurses think about the chaplaincy notes. The focus group study is one of the chapters in the book. So if you go to the book and you download it, you'll actually get Paul's study, and his name is Galschutt. Pascal, some people have asked about the study you mentioned about asking patients what they thought about the chaplain's chart notes. And one person said they have found it in French, but not in English. Is it in English yet?
In English, there is a short version, and I can send it to you, so you can send it to the participant. It's not the whole article, but it's quite the content of the article is in there. I can send it to you.
Yes, if you send us that, we'd be happy to post that. So Simon, somebody was kind of listening to your comment that it may be premature for us to name best practices, that we're still just kind of describing the range of practices, but they wondered, is it premature to describe bad practices? Or do we have enough information to kind of say these are the directions that we shouldn't be going in?
Good question. I think it's easier to name the bad. Perhaps it's too strong to say bad practices, but I think you can describe what doesn't function at all. So there are experiences with the process of developing a tool of charting. And I think, for instance, in the article of Brent Peary, he describes very well the process of development of their tool, and there is a lot of information about pitfalls. Perhaps it could be added with further pitfalls. So I think, of course, if you get the word evidence-based very narrow, then we should also be hesitant about speaking of bad practices. But I think there are clear lines in which direction the process should moving forward. And the point of overstructuring is not only an issue that comes up in chaplaincy documentation. We can also learn from other professional work on charting. So, and there's a lot of literature that we should use too. So I think we are on one hand at the start of this process, but we can learn from the last 2 decades a lot about future direction, I think.
Thank you, Simon. And you mentioned actually Brent Peary's name. Brent has a chapter in your book, I believe, and has also done other work in this area. And we should mention in the United States, Brent is leading a committee with our Association of Professional Chaplains that is in conversation with the EPIC a company about kind of a model template for chaplaincy documentation. Some people have kind of said, where can we get, some people in the Q&A have been asking about, where can we get best practices? Where can we get examples of best practices? So the Association of Professional Chaplains will be developing this model and kind of offering that. But it does feel like that may be another area for future research, is that, you know, people who have, you know, developed good practices, if we can collect them, as you said, perhaps in a book of case examples and things like that.
I think it would be good for the development in this area to try and test several paths, several ways of documentation, and then I think in a process of clearing up, some models will survive and others will die. So I think it's a pluralistic approach to this field at the moment is seems me wise for building a good groundwork for future practice in this area. So I think this we were very excited and marveled about the Brent Peary's model, which is very, very elaborated, but I think it's not the only path for future charting models. In my feeling, it is a little bit overstructured, but it depends how do you use the model. I think this difference is also important. The model is one thing, and the concrete usage of this model is another point. You can maybe very structured model used in a very simple form, but these are all experience we have already. We have to collect and test in the future.
Including, I would just suggest the scales that are often, so I know they have a suffering coping scale, and again, how do we know that those are helpful, validated scales, ways of capturing distress? They're a self-reported kind of chaplain observation of the level of distress, but I think that would be important to run by folks as well and to do some research on. Other questions, George?
You know, there's a few that have gotten quite specific, you know, so around situations where spiritual care is reimbursed and the documentation has to provide information for reimbursement. Some people were kind of curious about that and concerned whether or not that actually was shaping spiritual care or the documentation of spiritual care in ways that were not helpful to the kind of core for what people might imagine chaplains' key practices ought to be. I'm not sure if I'm representing the questioner correctly, but right. So you said that one of the places where that's happening is in Canada, where they're being reimbursed.
Quebec.
Yeah.
Yes, in Quebec. And also in Switzerland, in the canton where I'm traveling, that's also the case. But it's really very different. If you have to show every action what you do and the impact and what is coming out, then it could be danger. But if the importance is to show the contents of what spiritual care is doing, then it's also an opportunity. Like this, the healthcare system in Switzerland, they learn that spiritual care dimension is important for healthcare, and we are part of the story. So it's not only a danger, it's also an opportunity. It depends how you have to show what you do. For us, for the moment, it's very important that we can show what we do, also on a legal framework.
It sounds like there's always an opportunity to have greater integration and recognition of the importance of chaplains
that's
with the risk of limiting
yes,
this.
Yes. But it also challenges us to say more exactly what we are doing. You see, for us, for the moment, it's more opportunity than danger, like I feel it. It brings more integration.
And this Canadian model is also an exemplary case for having this economic constraints that pushing forward the development. But what they have done with these constraints is a very creative and productive form of a model of charting, which isn't medicalized at all. So they have a very strong emphasis on this spiritual aspect of healthcare chaplaincy work. So I think there is this tension, of course, and it was since the beginning. So also the outcome-oriented chaplaincy paradigm was incited by this economical pressures. So I think you can do a good work, or you can handle it very creatively, this extraneous frameworks or pressures on our profession.
Simon, is the Quebec model one of the chapters in the book if people wanted to learn more about that?
Yes, it is. Yeah.
Okay, yeah, good. Do I have time for one more, Christina?
Sure.
Yeah, so our good friend and colleague in Birmingham in the UK, Paul Nash, is listening in, and Paul has asked, Paul works, I should say, in a pediatric hospital. We're planning a research project comparing data with the patients and parents using the PROM. Some people will know the patient-reported outcome measure that was developed by our colleagues in Scotland, Austin Snowden and others. So comparing the PROM and chaplains doing a taxonomy on the same encounter. Some people will remember the Chaplaincy Taxonomy from Advocate. Does the panel think this would give us the evidence-based practice that we need? With a multidisciplinary consultation team, what else would we need to ensure as we test our notes? So a little research consultation in the last 2 minutes. Simon, Pascal, Jeanne, Christina.
It's a wonderful idea. I think that's the point, to integrate patients in this process, and it's certainly the best way what you are planning now.
I guess my question would be, how do you also interface with other members of the interdisciplinary team then in terms of their assessment of its usefulness and impact on care?
Yeah, I know exactly part of what you want to kind of draw in, right, as you kind of inquire. Yeah. Let me just say in closing, Christina, that actually there are two things quickly. A Canadian colleague has mentioned that there are 10 provinces and territories in Canada, and spiritual care is actually different in each one, because healthcare in Canada is very much in the province. May not be the same if it's in Quebec one way, but it may not be the same in Alberta and British Columbia. But several people have actually asked questions about, what if I'm not working in an acute care hospital? What if I'm working in long-term care? What if I'm working in hospice? And I'm assuming that all of the questions and things we've been discussing actually, all have to be worked out in all the different healthcare contexts where chaplains are working, outpatient contexts, et cetera, et cetera. And with that, I think I'm going to wrap it up, let you guys comment on that. And
Thank you, George. We have one more slide, and I'll just say just about Paul Nash's proposed study that I think one of the most interesting things would be having in PEDS, including family members. And that's something we haven't talked about, is how to document spiritual care provided to someone other than the patient. I saw some questions about, like some of the research that was mentioned, as well as forms and assessment tools. So you can sign up if you're not already part of the Chaplain Functions Network. It is part of Transforming Chaplaincy, and if you go to the Transforming Chaplaincy website, there are links to sign up to all of our networks. And we use a platform called Mighty Networks, and we share different articles and other upcoming events on it. And this PowerPoint and presentation will be available to participants, but for all of our past things, if you'd like to go on Mighty Networks and look, we have had conversations and sharing of assessment tools on Mighty Networks. So you might find some interesting things there. And again, stay tuned for upcoming webinars specifically about open notes. And with that, I'll just say a huge thank you to Simon and Pascal for your wisdom and time and expertise. And thank you to everyone who has participated and asked so many great questions. I'm sorry we couldn't get to everything, but it shows a lot of the interest and enthusiasm about chaplaincy and about this topic of documentation. So thank you.
Thank you.
Thank you.
Thank you.
All right.